Could you please tell us your name, sir?
My name is Pascal Mendy. I'm a Gambian residing in Germany.
In Germany. Pascal, we told that you are behind this gesture in the name of Right to See charity, people help people. Let's start with what motivated you to come with such a name?
This name motivated me because the right to see, which means everybody actually has the right of vision. Yeah, and people help people like anybody, any individual can be part of it, can help in anyhow. Yeah, so that's why people help people. So we are choose this this slogan, people help people, to encourage people or to invite people to come and be part of it in any form of help you can give or render to the organization or to the community.
We've told that the healthcare, eye care service is very expensive, but you are here giving a free service to the community of Tanji. Why?
Because I think I'm a bit privileged than some of them, and if I have the means to get these equipments or services or whatever for free, and in Germany I demanded to be given that, I will bring it to the Gambia and give it to the community free. And giving is living, and that's my motto in life.
What message will you share with your fellow or with your counterparts? Not actually people that work with you in Germany, but the charities that are in the Gambia, and they're trying to restrict support to the underprivileged communities. What will you tell them?
Yeah, but charity. My understanding for charity is giving for free, especially to the underprivileged. No? So I think I always repeat, my motto in life is giving and living. The more you give, the better you live. Yeah, and giving somebody donation or help or privilege, you feel better yourself. Yeah, and motivation. Please help people. Whatever you can. There's no little help.
Do you have any plan to spread support to the rural communities, or you are only restricted within the urban country?
No, our plan actually is to reach out to the rural community. But with that, we need logistic, a good logistic in forms of transport, and for the moment, the only transport we had was a vehicle that had been destroyed here in the Gambia, massively destroyed, and it seems like nothing is coming out of it. And we pledge or ask the government, to see, after this case, and see that, we are giving our transportation, for the betterment of our logistics, because we want to move, up to Basse or Fatoto or wherever.
Okay. So, what advice would you share with the people that are here today, directly benefiting from Right to See project?
Yeah, advice is, let them, if they benefited from it, let them tell it to their neighbors, to their friends. Let them use the opportunity. Wherever Right to See is, let them come and get their eyes checked or whatever. Either they would be issued with normal glasses or sunglasses or medicine or referred to the hospitals, whatever. So let them take use of it. Yeah, we are here. The materials we bring to the Gambia is to be giving out. We don't want to store them. So let them come, and anybody who can benefit from it will get his own share.
Thank you for speaking to the media, Pascal.
Thank you very much. Thanks for inviting me.
Thanks. Good afternoon, Chairman.
Afternoon.
Could you please tell us who you are, your name?
I am Ismaila Gomez, Chairman of Right to See charitable organization.
Chairman, we are here today in Tanji, providing free health screening,
Yes.
which involves eye, and you're also giving them free glasses and lenses. What is the relevance of this activity?
Yes, it's relevant because we know that sometimes some of these things are expensive. And as you see our name, what it depicts is Right to See. We feel everybody should at least have the right to have a proper vision. But having a proper vision, most of the time goes with cost. and some of these costs are beyond the beneficiaries of this program. Yes, because for us, we do it free. We do the screening and then give glasses where the patient needs it, or we give medicine if it's only medicine. So everything that we do here is free to make sure that people have their proper vision and then be able to see clearly which is their right.
In implementation of such an activity, sometimes you come across hurdles, difficulties. Could you please highlight some of the difficulties that you face along the way?
Yes, it's not easy most of it because our intention is to cover the whole, to go wherever our service is needed. That is from Banjul to Bolibanda after Koina. yes, but sometimes mobility is our constraint. We used to have a vehicle, but some of these technicians, it was taken to a garage, and then that mechanic, tamper with it seriously, and eventually even sold it. So now we don't have vehicles. So if we are to move anywhere, we have to dip in our own pockets to hire a vehicle to transport us, and then the equipments and the glasses, anything that we are taking there. And then sometimes we stay. Most of our outreach, we see a lot of patients. Yes, we see up to 250 patients. And then it takes long. Even examining one individual on eye takes a long time. So obviously the team members too, we don't want them to be hungry while giving the service. So we always want to provide breakfast for them. And then when we go home, then each and everyone go to your own home and eat. But for breakfast, because we always want to move early. If you want to wait for everybody to go and have your breakfast and come, it will take time. So you want to gather at a place, have our breakfast, and move together very early. Yes. So those are some of the challenges we have. That is move. The serious one even is mobility.
Mobility. Okay.
Because if we cannot move, we cannot go to the station where we intend to get the services.
Okay, so if you are to be open up to a support, an individual should approach you for a support, what area would you want them to chip in for you?
Yeah, I think if we want to prioritize it, maybe mobility is our first priority, which I know it may be on the high side. But if they want to come in any way, that is because even we can to buy food and something if we are going out. We provide breakfast for the members. We have breakfast and move early. That is this thing. But our first priority is mobility. Mobility. Yes, it's mobility.
And then finally, what advice would you want to share with the beneficiaries, those that are coming directly to benefit from this gesture?
Yes, that is a very good thing because, as I said, we are doing it free. So if you come here and benefit from the services of Right to See, we want you to tell other people, at least to contact us. We are on Facebook, we have our website, and we are on WhatsApp.
Okay.
So if anybody follow these groups, you will be able to know where will be our next outreach station. Like from today, our next outage will be at Old Just One Clinic on the 15th of February. So after that, this thing is already out, the timetable of where we go. So if anybody wants to this thing, you follow up, and then people come here too, they can go and tell their relatives or anybody that Right to See is giving free eye care services and lens and everything. Everything is free.
Okay, thank you so very much.
You're welcome.
They would have been seen before. But you in a community have eye problem, you know it, or you don't know how to take care of it. So by the time you try to solve it, maybe it's done beyond.
So what are some of the ways what could be used to prevent eye illness?
Well, one most thing I think important is regular eye check. If you feel something, you rapidly go to the clinic to check your eye. Just it may go beyond your own control.
And some people don't seek any professional advice. My eye aches, I go straight to the pharmacy to get the eye drop.
I discourage that.
What can that cost to the person?
can cause a lot of damage. We have different eye ailments and different medication ailments. So if you just go to a pharmacy, who is just a pharmacist, but not an eye specialist, they may give you a medication that is not for that condition. So eventually it can aggravate it. And we even see some of those examples. Somebody who can buy the pharmacy for 2-3 days, the condition is still worsened, and then you have to come to the clinic. So we realize that maybe the medication is not the right one. Sometimes you need combination of medication. You can give one that is maybe for itching and pain. You have different medication for it. So eye itches and pain at the same time, and you use only maybe itching, the pain will not go. And by the time the itching is gone, the pain will have aggravated. So you go to the hospital. When it is available, you can buy it at the pharmacy. Pharmacy is all for that.
We saw it just last week. You see kind of a harmattan being sort of, not actually harmattan, but the whole environment seems to be clouded with dust. In that kind of situation, like it is happened today, is very good as a professional or as an optician. What advice would you give people to prevent difficult eye conditions?
Even not in that condition, but we would advise people to use sunglasses. For now, we progress for the chromic glasses. Chromic means sun, and we have to access the sun. It prevents you from sun, because sunlight also causes a lot of eye problems, like palladium and even cataract. So if the sun is too hot, the rays affect the eye. Sometimes you feel some pain in the forehead in the evening. So we advise people to use sunglasses, and use sunglasses only during the day. Chromic, I use it every time. It reacts to the light. If you are in the light, in the sunlight, it becomes shady. If you are in the shade, it becomes bright, like this one. But if you are in the sun, it changes color. So that you can use them anytime of the day and the night. Television, laptop, mobile, especially now we use a lot of mobile, laptop, and the rays really affects the eye.
All right, thank you so much.
It's a pleasure. Thank you.
léegi benn baaraam laa gis. benn baaraam léegi. waaw léegi. gisuma ko. léegi. loo gis daa wax. boobu ñeenti yëpp maa ko gis. ñeenti yëpp juróom yëpp gis naa leen. léegi. ñaar. léegi. benn. léegi lan nga gis. loo gis. gis nga leeraayu lamp bi. ah. gis nga leeraayu lamp bi. gis nga leeraayu lamp bi. waaw gis naa ko. ban boor la ñëwee. ah. leeraayu lamp bi ban boor la ñëwee. mu ngi nekk sama ngay joor. nan lay jot. waaw. léegi fan la nekk. léegi fan la ñëwee. ci kaw. ci kaw. léegi fan la nekk. maa ngi sama càmmoñ. léegi. ci suuf.